Okay, hey everybody, Dr. Glatz here. I've just been doing some online kind of preparatory work. I've been kind of looking at this whole thing like a scientist, a bit nervous about what's happening with the whole coronavirus deal. And I just wanted to mention some things. And everyone's talking about the real basic things that you can do, obviously hand washing and don't touch your face and wear a mask. I think wearing a mask is a good idea. If you can get one, wear it. It'll keep you from touching your face, kind of teach you to have better sterile technique. I'm going to leave that alone, although the one thing I would add to that is that just, wear glasses, some kind of safety protection. Those respiratory droplets, if they get in your eye, can be very infectious, and that's one thing that people are leaving out. Otherwise, try to cover yourself and don't touch things unnecessarily. Then the next question is, what do we do kind of in our day-to-day lives that we can avoid getting infected with this? Or if we do get infected, how can we keep ourselves healthy? Probably the best thing that you can do is, if you're doing any kind of sort of longevity stuff, or if you're trying to do any kind of diet, you're trying to do a low carb or something funky where you're stressing your body and trying to lose weight, now's probably not the time to be stressing your body. Good idea to get good night's sleep, making sure that you're eating a well-balanced diet. I would encourage people, and I'm one of the people that I like the low carb diet. It's worked really well for me, but I don't think now is the time. Our white blood cells kind of survive off of carbohydrates, and so complex carbs probably not a bad thing. Something more like a keto-friendly diet would be something that you want to be on. A couple of things to think about is zinc, like the zinc lozenges that we know people take for the common cold. It may actually prevent uptake of the virus into the cell, or help to prevent uptake virus into the cell by acting on a metalloproteinase enzyme that will kind of block the uptake by ACE2 receptor and also a TMP-SSR2 receptor, I believe. Anyway, that combination requires this metalloproteinase that zinc can basically block. So there's a long way of explaining that those zinc lozenges are probably useful. You'd want to do those, starting when you first develop any kind of symptom. Probably not a bad idea to do a little bit prophylactically and then stay on it. The problem with that zinc is that it would only be mostly for the pharynx. There probably wouldn't be a lot of exposure into the lungs, but still not a bad idea to slow the progress of the virus. The next thing is lactoferrin. Lactoferrin is kind of one of these little things that you can get online, and it has a similar effect. It binds metals, and zinc, being a metal, it's been shown, at least in vitro, to slow viral uptake and progression of the disease. So not a bad idea. It's simple, easy to get, but I understand that now people are going after it, so you may have trouble. Vitamin C in general is decent for the immune system, especially if you lack any of that. You probably want to take that. Vitamin D is very interesting, okay? And probably the best place you can get it is going outside and getting sun exposure, okay? You're not going to get coronavirus from the sun, so go outside, be active, stay away from other people. But vitamin D may be one of the reasons why viruses are less common in the summer. We always thought that people are in the cold and we're overexposed to one another, and that increases the risk of the virus, and that probably is true to some extent. But it also looks like vitamin D may be an issue in the winter months. We're inside, we're not getting a lot of sun exposure, our vitamin D levels go down, and that may be playing a direct role in why people get these viruses. Is it going to do anything specific for the coronavirus? Maybe not, but we're just talking about general overall health and well-being at this point. One of the other things I would tell people, and I've been doing this, I like to do the longevity thing. I've sort of been taking resveratrol, turmeric. I've actually been on low dose blood pressure medicine, some other kind of quirky things. Now is not the time to do that. A lot of these drugs that increase longevity, they do so by acting through the sirtuins. And these have a tendency to increase this ACE2 receptor. ACE2 is part of the renin-angiotensin system that manages our blood pressure, and so what we know is that people that have high blood pressure are more likely to die. People that have high blood pressure are more likely to express this ACE2, okay? It's a protective mechanism. But people that are taking medication like an ACE inhibitor, okay, will also see increase in this ACE2, in this ACE2 enzyme. Not to mention the again, resveratrol, turmeric, all of these things that are sirtuin activators. So I would probably, anything that you've been doing like longevity, diet, now's not the time. We're gonna regress back to basic things, vitamin C, vitamin D, control our blood pressure if possible with things other than ACE inhibitors, okay? I'm not your doctor, or probably not your doctor for your blood pressure. So if you're gonna change from an ACE inhibitor, make sure you do that, under someone's guidance, not because I'm mentioning this now, okay? Again, avoiding pretty much all longevity drugs, so resveratrol, turmeric, those kind of things. And we discussed sun exposure. So let's go over those again just to kind of cap it all off. We talked a little bit about lactoferrin, we talked about zinc, we talked about vitamin C, we talked about vitamin D, avoiding ACE inhibitors, and longevity drugs. Get back on a regular diet, complex carbohydrates still, there's no need to do processed carbs for anybody, and then sun exposure. And those will probably be good. Stay away from, don't infect old people, okay? People that are less than 50 have a less than 1% chance of death with this. When you go up in age, that increases rapidly. So just be intelligent. Don't expose older people to this disease. And if you dig this, let me know. I'm going to probably be doing more of these going forward. And I even thought about doing like a blog page to sort of bring more high-end, sort of confusing issues down to a more of a basic level. Anyway, good luck.